Hello and welcome to the EDU-TALK series hosted by BIOTONE, BIOTONE Edu Partner Program, and massage industry experts. Though we've come through the worst of COVID, there are still challenges facing massage schools, students, and practicing therapists. The EDU-TALK series continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Judith Koch Stapleton, who is founder of the Institute of Somatic Therapy. She began her massage career in 1991, and in 1993 became certified in prenatal massage. And by 1999, became an approved continuing education provider through NCBTMB. Let's listen and learn as Judy shares her practical knowledge gained from, I hate to say it, decades of practicing prenatal massage. She'll discuss the importance of specialized training and how prenatal massage is more than standard side-lying position massage. She'll explain the physiological changes that take place during pregnancy and offer modifications necessary to work each system in the body for not only client comfort, but successful pregnancy. And Judy, welcome. And before I turn over the talk tonight to Judy, please be sure you are muted and your video is off. And please feel free to chat Judy questions during the EDU-TALK, which will be answered at the end of the evening. And Judy, with that, I turn the show over to you. Thank you.
Well, thank you, Donnell, and thank you to BIOTONE for making these talks available. And thank you to everybody who's joined us. And yes, Donnell, I just realized this month is the 30th anniversary of when I started massage school. So it has been decades. So you see it in the gray hair. But I want to start out a little bit tonight. 30 years ago, when I started massage school, one of the first things they told us that pregnancy was a contraindication for massage. And at the time, I was learning so much stuff, I didn't really worry about it. But within about a year of my private practice, I had 3 clients that all got pregnant right about the same time. And they all wanted to keep coming for massage. And I thought, oh, I'm not qualified for this. I need to learn more. So that started me on a quest to learning more about pregnancy and adapting massage therapy for pregnancy. So the first thing I did was fly halfway across the country and take some specialized training because there weren't a lot of trainings available back in the day. And I've just grown from that and built from that and continue to take training and of course amassed a lot of experience and taught a lot of classroom hours. So student questions helped me to learn a lot too, because when students bring you a question, if you don't know the answer, you go find it. So I've continued a 30-year love affair with massage therapy and most of that time working with pregnancy, and I'm excited to be able to share this with others. And let me just first off state that pregnancy is not a contraindication for massage therapy. In fact, I wouldn't be surprised if everyone listening right now has given a prenatal massage, even perhaps without knowing it. The average woman doesn't realize she's pregnant until she's at least 4 or 5, sometimes 6 weeks along. I worked in a hospital in high school. We had a lady who didn't know she was pregnant until the head came out 9 months into her term. She thought she was having a stomach tumor and pains and came and checked herself into the hospital. And next thing you know, she was delivering a baby. So it's possible to give a prenatal massage without even realizing it. If your client doesn't know they're pregnant, then you're not going to know they're pregnant either. So a lot of people have this idea that, well, you can't give a massage during the first trimester. Well, I am here to tell you that for the first half of the first trimester, she probably doesn't even know she's pregnant. So if she doesn't know she's pregnant, you're not going to know she's pregnant. And a lot of people have this fear or worry that massage is somehow going to cause a miscarriage, that's why it's contraindicated. It's so inherently dangerous. Well, the question I've asked people before is if you could have a miscarriage by getting a massage, then why is there an abortion industry? Because if all you have to do is go get a massage, I think that would be better than to have to go to other means to end a pregnancy. So I personally am not aware of one single instance of a miscarriage being caused by massage. But I'm also well aware that a lot of miscarriages do happen in the first trimester. So I go overboard to make sure that I don't do anything in the first trimester that might set a question in my client's mind if she happens to have a miscarriage within the week after the massage. So I avoid the abdomen completely. I'm very cautious around the feet zones, the different reflexology zones and acupressure zones along the feet. And I'm also very cautious with the low back on pressure for the first trimester. So I do recommend that you make modifications in the first trimester, not because I believe that you can do any harm, but because I believe we should err on the side of caution and just make sure our client is comfortable. And there's a lot of things we can do without having to worry about the fine-tuning those points that we can get to in the second and third trimester. And another kind of nasty rumor about massages with lactating clients. I don't know if any of you have heard that, oh, a breastfeeding woman should not get massage because of all the toxins. Well, that logically doesn't stand up either. Massage therapy offers no new toxins into the body. And if there are toxins in the body, they are going to make their way into the breast milk. But if massage can help the body move those toxins out through normal means, you're actually then going to reduce the amount that lands in the breast milk. But if you do happen to have a nursing client that's concerned about it, I just tell them to do what the Lamaze teachers call pump and dump. Okay, come get your massage. The next time, pump and dump. Maybe bank some milk before the massage if you're worried about it. Personally, I don't think there's anything to worry about with that. But again, I believe in erring on the side of the caution. If it would make your client feel better, that is a suggestion you can make for them. So one of the biggest questions I get asked all the time is, well, why do I need specialized pregnancy massage therapy training? Can I just lay a woman on her side and give a massage? And the short answer is yes, of course. We can perform a massage sideline on a pregnant client. What is missing without the specialized training in the pregnancy massage is a thorough understanding of everything going on in the body. They're not just pregnant in their uterus. Every system of a woman's body has some changes, some of them pretty significant, that are going on during the pregnancy. And the more you know about all the physiological changes that occur during pregnancy and how you can adapt your massage for it, you're making a safer massage for your client, you're making a more effective massage for your client. So that's what I'm going to kind of focus on this evening. So let me get my PowerPoint up here shared for you. And let's take a look at this. Okay. So the title of the talk, Physiological Changes During Pregnancy and How They Impact Massage. Here we go. So a few key concepts to keep in mind. First of all, every screen, I can't see. There we go. Sorry about that. Okay, every system of the body, as I mentioned, is affected by pregnancy. And almost all of these systems are going to require a change in the massage technique and they're going to benefit from a change in the massage technique. The more you understand about what changes are occurring in your client's body, the more you're going to be able to respond to those changes in a way that's more effective, more appropriate for her body. And yes, any one of us without training can place a pregnant woman in a side-lying position and we can give an adequate massage. But the more we know about these different changes, the more beneficial and safer the massage is going to be. Now, on the following panels I'm going through, unless otherwise noted, the source of statistics come from the Principle of Human Anatomy by Gerard Tortora. So the first change, obviously, in the female reproductive system, these are the most obvious changes. Prior to pregnancy, a normal uterus is about 70 grams, roughly 2.5 ounces in weight. And by the final week of pregnancy, the uterus itself, not talking about any of the contents, we're not talking about the placenta, the baby's weight, the water weight or anything, but just the uterus itself has expanded to be as much as 1,200 grams or over 2.5 pounds. And it occupies nearly the entire abdominal cavity. So as this uterus is growing, it starts to displace and compress most of the abdominal organs. And the uterus, as it changes positions, the ligaments that support it are placed under considerable strain. In fact, positioning is one of the main reasons we modify the position. It's not just because the woman can't lay on her stomach, but we have to be cautious about not straining. A prone position with improper uterine support is the most likely way that you would cause some discomfort to your client to the uterine ligaments. As you can see, there's round ligaments in the front, and there's two. This is one side of the body, so there's one on each side of the body. And if she is laying on her stomach without a good solid support under the uterus, then those round ligaments can get displaced and have tension on them, as well as the uterosacral ligament shown here in the back. This ligament often mimics low back pain as well. So if you want to use a prone positioning, I know there are a lot of massage therapists that prefer continuing that position, and there are different body cushioning systems available to help you achieve that. I personally have never used those. I found that there can be a challenge to work with. I've got some things about them I don't like, but there are people that swear by them and love them. So if it's something that you have and you want to use, my suggestion is that you're really cautious about making sure that the uterus is fully supported. You don't want any gap between her belly and the support, because if that stomach is allowed, if their abdominal region, the uterus and everything is allowed full gravitational pull without support on it, then you are going to cause some pain to the round ligaments and the uterosacral ligament. There are also a lot of changes taking place in the cardiovascular system, dealing with the heart, the blood vessels, and the blood. The cardiovascular system increases the output of blood by 20 to 30% by the 27th week of pregnancy. And the heart rate increases about 10 to 15%. This is a reason that pregnant women have to be more cautious with their aerobic exercise, because their heart rate is already increased. And the total volume of blood in the body increases roughly 30 to 50%, most of that during the final trimester. The body actually starts to bank extra blood in preparation for the blood loss that's going to occur as a natural part of the delivery process. So all this extra blood flow, we have to be particularly cautious with the vena cava, which is located just to the right of the spine. It's the vessel, as I'm sure you know, that corresponds to the aorta on the other side of the body. The vena cava is what carries the blood back from the legs to the heart. And if you have your client in a position that is compressing on that vein, it's going to impact the blood flow coming back into the heart. If she's laying flat on her back, that is especially the worst position because the most compression is going to be on that vein. If you lift her up to about a 45-degree angle instead of flat on her back, that's sufficient to shift that weight of the baby enough that the blood flow can normalize. The weight of the baby also can compress the aorta, but it's less of a concern because the aorta has the heart right there in the volume, the pushing of it, that gives that blood more velocity when it's leaving the heart. But we don't have a heart in our feet that push the blood back up. So it takes more effort to get the blood back up. And that's why we have to be more concerned about the vena cava. So the impact on massage with this is to use the positioning to keep the weight of the baby off the vena cava. And again, that's usually can be achieved by shifting her back to about a 45-degree angle. And we also have to be aware of varicose veins. There's a lot more blood in the body. So we have to look for where they might have varicose veins that they perhaps, or spider veins that they might not have had before. We also want to avoid any kind of percussion strokes because she's more likely to bruise. And if you do any kind of percussion strokes with the blood vessels full, you're increasing the chances that you can rupture some blood vessels. And here's a map or a drawing that shows you the vena cava as it's coming back up. It's a very large vessel, and the aorta would be on this side over here. Next, the pulmonary system, the breathing or respiratory system, consists mainly of the lungs, the air passageways, and its purpose is to bring oxygen in and release carbon dioxide from the body. And the blood flow, of course, and the airflow help to bring oxygen and nutrients into the body. And it also, we remove toxins from our body. Total oxygen consumption increases about 10 to 20%, but we don't breathe pure oxygen. So we have to increase the amount of air that's inhaled by as much as 30 to 40% in order to get that oxygen increased consumption that the body needs. So the breathing can easily become more labor. So what we want to do during the massage is we want to make sure that we release the intercostal muscles. The more muscle restrictions that we can alleviate between the ribs, it's going to enable them to move more fully, open more fully, and thus allow for easier breathing. And this diagram here kind of shows you what's going on with when you take a breath in, your ribs kind of lift up and open out a bit more as your lungs inflate. And then as you exhale, it releases back. So during the full inhalation, so that they can inhale to their fullest, we want those intercostal muscles as flexible, loose, and unrestricted as possible. Next, let's take a look at the digestive system. The digestive system consists of the gastrointestinal tract, the stomach, the salivary glands, and even the liver, gallbladder, and pancreas, the large and small intestine. All of that are part of the digestive system. And some of the changes that are going to be occurring to this part of your pregnant client's body is that, first of all, you've heard about we're eating for two when we're pregnant. Most pregnant women do take in more calories, and that extra food has to be processed by a digestive system that's already being crowded out by the enlarged uterus. So the intestines become displaced, and both the stomach and the diaphragm are pushed upward. One common result of this is constipation, as the bowels are compressed, but also nausea and heartburn from the food not moving quite as quickly as it would if things are being compressed and pushed around a little bit. Now, the impact for massage on this, obviously, because of the extended uterus, we're not able to go in and do like a colon sweep like you may do on your non-pregnant clients. The best way to impact the digestive system through massage therapy during pregnancy is going to be by using reflexology techniques. I primarily focused on the feet, but there are, of course, reflex points in the hands and the ears. If you're familiar with those, you can actually work those in all places. Okay, next, the renal and urinary system. The urinary system is made up of the kidneys, the bladder, the ureters, and the urethra. And the changes that are happening here is that the renal system has to increase renal plasma flow by about 35%. And the glomerular, I know I'm probably not saying that right, filtration increases by about 40%, the filtration going on within the kidney system. So the function of each one of this glomerular, I'm sorry, I'm not good at pronouncing these words. It's to bring blood and waste products it carries to the kidney area. And the urinary system, including the ureter and the bladder, having a lot of pressure on them. And the main thing your client's going to find is increased frequency of urination and possibly even urine leakage. And that's one thing you may need to get up and use the restroom between massage more often than a non-pregnant client might do. The impact on massage, again, there's not like specific techniques we can do on the bladder to keep the woman from needing to go less often, obviously. But general circulatory work can have a positive impact on her body, and also teaching her Kegel exercises can help assist in bladder control. Kegel exercises are also good for in labor. It helps the woman have better control over relaxing as the baby's coming out, and it also increases muscle tone, which makes her more effective during the pushing stages of labor. The skeletal system also has some change you need to watch out for during pregnancy. Of course, there's the extra weight is probably first and foremost. There's a shift in the center of gravity. So you're going to find that this extra weight in the midsection, it can cause an unusual lordosis of the lumbar spine. It can just all the postural shifts. They start walking differently and holding themselves differently. And anytime your foundation shifts, everything up from there shifts, and you'll start finding aches and pains along from head to toe, really, that they wouldn't have without that postural shift. And another concern that we have to watch out for is there's a hormone produced called relaxin, and it does exactly what it sounds like it does. It's to relax the ligaments. The purpose is so the pelvis can spread for delivery, but there's no way for the body to just target the pelvic ligaments. So all the joints of the body are less stable during pregnancy. And where you're going to find this mainly is it's going to impact us when we start getting into stretches of mobilizations. But when you take the instability from the shifted center of gravity, you're going to find your pregnant women find they're feeling less coordinated, they're less agile, less stable. And anytime you're off balance, sometimes you kind of catch yourself and step wrong. There's always aches and pains that come with that. So the impact that we're going to watch for is, first of all, let's look for low back pain caused by lumbar stress. Definitely want to address a lot of low back work with our pregnant clients. You don't want to do strenuous range of motion movements because of the lowered stability of the joints. We want to be extra careful that we don't cause any joint pain unnecessarily. So any stretching techniques, I would suggest that you do them more gently in your pregnant clients than you would in your non-pregnant clients. The endocrine system are the hormone producing glands. These are sending chemicals through the body, and especially during pregnancy, there are more hormones in the body than usual. There's progesterone and relaxin that we've already talked about, the relaxin. And estrogen, of course, plays a role in pregnancy, but it's not unique to pregnancy. Progesterone prepares the uterus for receiving the fertilized egg and helping to implant. And it also helps with the mammary glands for lactation. And relaxes, we've talked, it does what it sounds like. It relaxes so that the pelvic ligaments can relax, and also helps the cervix to dilate. The placenta also produces hormones. Probably the most well-known one is the HCG. This is, quote, the pregnancy hormone, as they call it. This is what your pregnancy tests look for if you're doing an over-the-counter drug test for pregnancy. And it helps the body produce more estrogen and progesterone as well. And oxytocin stimulates contractions of the uterus. Pitocin, if you've heard of using Pitocin to initiate or augment labor, is actually artificial oxytocin. And prolactin stimulates the production of milk. So there are a lot of different hormones in the body that are not normally there. And again, it's not like we can go in and massage these, you can't go in and massage the placenta, but just performing general circulatory strokes can assist in the movement of hormones throughout the body. And really, again, I don't mean to overemphasize this, but we do need to watch out for the relaxin. Next, we're going to talk about the skin, the integumentary system. The skin, the sweat and oil glands, hair follicles, and nails. The changes during pregnancy, the skin becomes more prone to rashes and breakouts. And it can also undergo a lot of stretching. You're probably familiar with stretch marks. And pigmentation changes can also happen. These can affect the face, the stomach, and breasts. And of course, the breasts also become enlarged as well. The biggest impact on massage is I generally recommend that you use a lotion or a cream instead of oil. Even though lotions do have some oil in their base, they don't tend to clog the pores as much as using just plain oil can. So just kind of recap, we're drawing to the end here. So to recap, the reproductive system, you need to be careful of positioning and the uterine ligaments. The cardiovascular system, again, positioning, watch for varicose veins, be cautious of bruising. Pulmonary system, you want to make sure you release those intercostal muscles. The digestive system, work those reflexology points, feet, hands, ears. The skeletal system, we just want to modify our stretches. The kidney is teaching the Kegel exercises. If you're using the restroom, just stop the flow and release, stop the flow and release. You actually practice them during urination a lot because that
We're having a little technical difficulty with Judy. Judy.
Okay. Is there anything you needed me to recap?
I would go back one slide. If you
Sorry,
can
I was just going right ahead. I didn't realize there were any problems. Is there anything you want me to try to?
Can you go back one slide?
Sure. Let me just go back.
Yes, this is where it started to freeze up.
Oh, okay. All right. So I was doing the recap. The reproductive system, the way that we help that is positioning and watching out for the uterine ligaments. Cardiovascular, also positioning for the vena cava, watching out for varicose veins, watching for bruising. The pulmonary system, we want to make sure that we release the intercostal muscles. The digestive system, we want to work on the reflexology points to help the body, the digestive system flow. The skeletal system, we want to watch those stretches and be careful of the joint instability. The kidney, we want to teach Kegel exercises. For people who don't know for sure what a Kegel exercise is, that is, a Kegel is just squeezing off. For example, if you're urinating and you squeeze to stop the flow and then release, squeeze and release, that's a good way to practice and get the hang of it, but don't do it normally during urination, because I've been told that can actually lead to a kidney infection. So you can kind of get the feel of it a little bit, but you want to practice that Kegel exercise. And we teach more about different Kegel exercises and such in the course, but that's something you teach your clients to help their gain the bladder control. And for the skin, we want to avoid greasy massage agents. Donnell can give you, I was a big BIOTONE user my whole career. So I use the advanced therapy formula a lot, and there may be others that they recommend. And if any of you are interested in coming through us to become certified, to earn the title of Certified Prenatal Massage Therapist, we also have Certified Infant Massage Therapist, Certified Doula, and Certified Fertility Massage Therapist. All of those courses, what you can do is go to our website, massagecredits.com, and you'll see this lovely smiling lady when you get there. And right next to the home button, just click here where it says courses. And what you're going to see there, the top page of that, I have all 4 of our certification courses at the top. Also look for this customize your own package, because if you are enrolling in several courses, we do have some package discounts here for you. But our Certified Prenatal Massage Therapist package is this 4th one over here. And you can click that View Details, and it will take you to the course description page. And that can give you all the information. We've actually broken it down into 2 steps. Step 1 is the prenatal massage fundamentals, which is everything you should know before you massage a pregnant woman. And then step 2 is the prenatal massage techniques. That's what you're actually going to do with your client while she's on the table. So that is available to you, and I will be offering a coupon code just to those of you who are here today. So Donnell will be emailing that out to everybody within the next day or 2. But again, just jot down if you're interested, massagecredits.com. That's where you can go.
Well,
thank you all for your time and attention.
Well, thank you. And we avoided major technical difficulty, so I'm happy about that. It was just the last part of it during the recap. And what I'd like the audience to know is that we will be following up with a link to Judy's recording for tonight's EDU-TALK. And we'll also include a copy of the PowerPoint presentation, which she just went through, which was so informational. I haven't really seen any questions come in.
Let me just tell everyone, I do have a contact us link on our website. If you think of a question later, just go there, go to massagecredits.com, click the contact us, and send me an email, and I'll do my best to answer your question for you.
Okay, and I have a simple question, because at the beginning you mentioned the reflexology, and be careful about massaging pregnant women and reflexology points. And then
I think
for digestion, you brought in reflexology again. So it sounds very important that people would understand the reflexology points for pregnancy massage to avoid, and those that can help.
Right, and basically it's the points that are specific to the reproductive system that we're being cautious with during the first trimester. And actually, I'm cautious with those points throughout the entire pregnancy. I've had people that want me to help induce massage, and if there were just a special little point we could push on somebody's ankle and they magically go into labor, we could all retire rich right about now. You know, people give us too much credit with these reflexology points. I don't want to downplay them. I have been in the labor room with clients hooked onto contraction monitors, and I can press in on the uterus points on their feet and watch that monitor move and release and watch them on back. I've seen that happen. I know unequivocally that those points do impact on what we can actually see on the contraction monitors. I've found, I think it's more effective when the water is already broken, because I've seen a bigger difference. So I don't want to downplay those points. We do want to be cautious with them during pregnancy. But if you've got a client that is 40 weeks or beyond, her doctor's threatening inductions, which inductions always tend to be a harder labor, then by all means at that point, if you want to start working those reflex points and show her how to work them, yeah, you know, go for it. So, but up until that stage, I do suggest just a little extra caution around those points. Again, there's no harm in erring on the side of caution. So that's always been my philosophy.
Well, thank you for addressing that. And thank you again for joining us tonight. I'd like to let our audience know about our upcoming author series into the beginning of August on July 13th. This is part one of a two-part series with Constant Hart, who will focus on utilizing color aromatherapy to support holistic wellness. On July 27th, we have How to Unravel Foot Pain Using Structural Reflexology. And that is by Geraldine Villeneuve. And then we have part two of Constance Hart's two-part series on August 10th, Create an Intention-Based Healing Space Using Conscious Colors. So those are some fun topics we have for the summer time frame, and informational as well. And the reflexology talk on July 27th might give some good points to pregnancy massage as well. So thank you very much, everyone, for joining us tonight. Judy's website again is massagecredits.com. And join us for our upcoming EDU-TALKs. If you've missed any over the last year, you can find them on biotone.com. And in the navigation bar, it's under blogs and EDU-TALKs. RSVPs do open tonight for the July 13th talk. Thank you so much for supporting EDU-TALKs and joining us, and Judy for sharing your great information tonight. And with that, we can say goodnight.
Well, I want to thank everybody for joining us as well. Okay, thank you.
Thank you, everyone.
Bye-bye.
Take care.